That's such a. I mean, um, how was that to meet the Pope? How does it feel
Well,
to?
he's not the first Pope I've met. I've been serving under
Uh,
the other two. So, but it was good to meet a Pope who speaks English.
okay. So you have
Yes,
met the previous Pope also?
yes.
Uh,
The previous Pope,
mm,
uh, Pope Francis, is the one who appointed me for the academy. So that
oh.
so that when this one joined,
Uh-huh.
he also said we'll continue with the Pontifical Academy. It's for life. So it's one of those where you are talking about health issues,
Oh,
and
okay.
I'm one of the few black women in there. So
Mm.
it's, I see it as a real honor. Yeah,
Wow, that's,
yeah,
I mean, that's
yeah,
a huge
yeah.
honor. That's amazing.
It is a huge honor because
Yeah.
I don't even know how the first one,
Oh.
chose me.
Mm-hmm.
But apparently, he said, well, there's somebody who's always writing in Africa about HIV.
Mm-hmm.
I agree with her on some things. I don't agree with her, so put her in. And
Okay.
yeah,
Okay.
so it was great. Yeah,
That's good. That's
yeah,
great.
yeah.
Okay. So, Professor, I know that so you have a lot of, like, many responsibilities. You are a
Yes,
special ambassador for the special ambassador for the African Leaders
malaria.
Malaria Alliance,
Yes.
and also you are still a co-chair, or you are the former co-chair,
Is former, yeah.
former
Well, with
co-chair.
funding, they had to cut that down. So
Okay.
I'm former, but there's really no other co-chair right now. So
Oh, okay.
yes,
All right.
yeah,
So you were
yes,
former co-chair of the Nursing Now campaign, and
yes,
also
yeah.
you were part of the Global HIV Prevention Coalition.
Coalition, yes,
Yes. So
yeah.
that's
Yeah. And I'm
how.
also chancellor of Botswana Open University. And I serve in quite a few boards,
Mhm.
Water Aid International
Uh-huh.
from London.
Uh-huh.
I'm supposed to be retired, but I'm kept busy, so it's okay.
How do you organize yourself to be able to contribute to all of those?
Well, I give my children are grown up, they're adults. So I spend quality time with them. For example, every holiday I'm with them. So I'm fine. I'm just one woman who's a busybody and
Okay.
takes care of herself. So I'm able to juggle, between them.
So, can you talk to me about the Malaria Alliance?
Okay. The African Leaders Malaria Alliance, which is ALMA for short, is actually an alliance of our heads of state, the African leaders themselves, the presidents. They came together and said, we need to do something about malaria because we are seeing that in other continents, some countries are getting certified malaria free, and we can also do that. But then, so they formed an office, and in there they said, when I was appointed, President Uhuru Kenyatta said, the songs in our ears that used to sing about HIV, we want you to sing about malaria, and we will listen. So I go now to countries really to encourage them to have bed nests, to do whatever, to connect them with others so that they can have assistance. And we are seeing actually the malaria cases going down, despite the fact that due to climate change, we're seeing flooding, and flooding comes with its own, the rise in parasites and all that. But the countries are now really, putting malaria high on the political agenda. So we will soon having color countries that are being certified malaria free. We've already had Cabo Verde, Mauritius. So we are hoping that Botswana, Eswatini, South Africa, and Namibia will soon be those countries that will be certified malaria free. But it means somebody pushing because countries have priorities. And sometimes it's really looking at, like, a country like Botswana will say, well, we have more people dying from this than malaria. Last year, they had six deaths from malaria. But then, that's too many, especially because when I was minister myself, there were no deaths from malaria. So I'm saying, no, let's have that record put straight. Yeah. There were less than 1,000 cases. Let's keep it that way. There were no deaths. Let's keep it that way.
Yeah.
Yes.
Yeah, that's what I wanted to talk to you about. That you are also a former health minister.
Yes.
And you were trained as a nurse from the University of Illinois.
Yes.
In Chicago. That's where you got your nursing degree.
My PhD.
Your PhD.
I got my initial nursing degree from Dillard University in New Orleans. Okay. Then master's degree from Catholic University. Another master's in nursing education from Columbia, and then finally the PhD in nursing from University of Illinois, Chicago. Yes.
Wow.
Yeah.
So, and as a nurse, and who was at that level of leadership and power in the government, how have you influenced the policies? How have you been able to influence the policies in a way that that promoted nursing, added value to how nursing is viewed and practiced?
Yes. Well, I'm hoping that it also influenced how nursing is viewed in the rest of Africa, because after I was appointed a nurse, I saw then other countries, for example, Seychelles appointing a nurse as a minister, Lesotho appointing a nurse as a deputy minister. So that I think countries were now able to see that nurses can be appointed and they do very well. So for me, but at country level, I'm come from a country where nurses have always been respected. Historically, nurses were the princesses. When training for nursing came, the princesses were the first to be trained, so that it was really always regarded as a decent, well-regarded profession. So for me, when I became a professor in nursing at the university, and that alone was influencing that I was also a collaborator for the WHO Coordinating Center for Nursing Education in Primary Healthcare, therefore teaching nursing from other countries, nurses from other countries on primary healthcare issues, so that it was really great. I became a minister, not as I was politically appointed, in that because of the work that I was doing at community level, having formed the Society for AIDS in Africa, where women from all walks of life were able to come in and do HIV work. The president could tell that, and also publishing on HIV and really the impact on women, impact on communities. The president of Botswana decided, I should come over and assist him in the AIDS response. So that's how I became a minister. I was borrowed from the university for just 5 years. And he knew that in those 5 years, I would be able to do quite a lot. But the great part was I had no doctors. I depended on nurses, on nurse practitioners, on midwives, on community healthcare workers, and on the population, especially the traditional leaders. And I was able to show that under a primary healthcare model, where there are no resources, you can actually utilize those cuts, have that human resources, and to do a lot. So that people then saw nurses what they could do, following up patients, being the ones to prescribe. And that lifted the overall perception of nurses in my country, even higher. So it was really great. Now, after 5 years, the United Nations, when I had finished, I wanted to go back to the university after very good results, but all because I was working with everybody, including nurses and midwives and nurse practitioners, we were able to bring down the rate of mother-to-child transmission from 29% to 8% within 4 years.
Wow.
And within those 4 years, we were able to roll out ARVs to 80% of the population. So, and the adherence levels were great because we're working with community healthcare workers to make sure that, and also our grassroots organizations to ensure that people adhere to that treatment, people have food to be able to take the drugs and all that. And that's why when I left, it was the United Nations said, no, what you did in Botswana, come and do for the rest of Africa. And that's when I became UNA's regional director for Eastern and Southern Africa, which was like 24 countries. Yes.
Okay, so that's good. So you are helping other countries also, like follow the same model
Yes.
approach. Okay.
Yeah, and it was great because nobody was saying we won't listen to her. She's a nurse. I came to countries where there were many doctors, but they knew that this woman has done quite a lot in her country, so that I was able to then work with countries all the way from Eritrea all the way to South Africa, including the Indian Ocean islands of Madagascar, Mauritius, Comoros, Seychelles, and La Reunion. So it was great, to be perceived that way. And with that, people are then able to see that when she is a nurse and she leads, great things happen. Yes.
That's great. I mean, we need that. I think there is a lot of room for promotion for nursing still.
Yes.
In a lot of countries, there is still a lot of work to be done. And I also wanted to ask.
Let me add that that's why when I was also regional director, I for the anniversary of Florence Nightingale, I became the co-chair of the Nursing Now campaign with Lord Nigel Crisp to go around the countries to be able to say to them, we will not be able to reach universal health care unless nurses are recruited, they are educated, they are remunerated and retained and really put in leadership positions. It became a very great campaign, except COVID broke it. So that a lot of countries had already launched, and we were working with our ministers and all that to really say, even in countries where the status of nursing is low, make sure that you put them in leadership positions. Make sure that you remunerate, you retain them. Otherwise, you are not going to be able to reach universal health care. Yeah. So it was really great. Yeah.
Well, yeah, that's interesting because they also, all those nurses helped a lot during the COVID crisis to help.
Yes.
Yeah. So they, I mean, they went above and beyond to, to take care of people.
Yes.
So the other question I have is you have done theater.
Yes.
As part of your, was it before you got in nursing? When did you learn theater?
Actually, I've always been in theater, in the sense that even at primary school level, I was an actor. At secondary school, I was an actor. When I went to university at Dillard, because I really wanted to be an actor, and also I didn't want to do anything with healthcare. Yeah. Really. Yeah. So at high school, I had applied for a scholarship to go and do the languages. I was very good in French, in Latin, in Greek, in English, and I thought that's what I should do. So, but I was told, no, this is a developing country. With the grades that we have, I had a first class pass. We want you to go and do anything in healthcare. And it was like, but I'm not interested. They said, your grades are saying you are interested. So when I then got a scholarship in nursing, I took it only because I was going to America. It had nothing to do with where I'm going now. It was more like, okay, I know the nurses. I mean, I have aunts who are nurses. I adore them. But I'm taking this one because I'm going to America. So when I got to America, to Dillard, registration time, they said you can have electives. I said, show me the School of Fine and Performing Arts. So that then I was able to say, look, with nursing, and if I do public health nursing, I can actually combine my skills and be able to help people, but also able to enjoy, theater and all that while at it. And that's exactly what happened. I was able, as a student, to direct a play among students. I graduated. I came back to the university, after I qualified with master's degree, came back to the university, taught nursing students, but at the same time, got them into the university theater because I was saying to them, look, as nurses, we talk about empathy. And the best way to empathize is to really be in the shoes of the person that you are dealing with. And acting is the only way where you can imagine yourself as Lady Macbeth and be that. That way you can be able to look at the patient and say, she's suffering. But how do I put myself in her shoes and be able to assist from that angle without that sympathy, but being able to just show that compassion, the empathy. So that then I also acted in, as in amateur theater as in one of our theater companies. But the acting that I really did where I was international is because a Scottish author wrote the books on the #1 lady detective agency. And he was still a great friend of mine. In fact,
I saw that. I saw that
in Botswana. That's right.
Yeah.
So he was asked, "Who do you write about?" Because they're really good books, are authentic. And he said, "I write about any one Botswana woman, but I write about Sheila Tlou mostly because I know her. I've lived with her. He lived with my husband and I in Botswana." And he would say to us, when you got married, what happened? We didn't know that he was actually collecting data for these great books. So that's basically that. So that I got to then act in the series. Yeah, as the aunt of Maramoso. Yes, with Jill Scott. Yes.
Oh, really? Wow.
Yes.
I saw that movie.
Yes,
I saw
it. Wow. Especially at the funeral scene. I'm right there next to Maramosa, and when she's singing, and I was here. That's when I was a minister, and Botswana was saying, no, she is Maramosa herself. She should be the one to act. But I said, guys, this is an international thing. We need somebody who can act, well.
Yeah, that was a really good show.
It was.
It really. I liked it very much. Yeah. I am actually working on a project here. It's called I want to create a creative and well-being space for nurses, also where they can engage in different kind of art. Yeah, because as you said, it's good for them to improve the quality of the care they provide, and it's good for them for their own well-being because it provide emotional stability, especially when you are dealing with a high stress environment, and
that's right.
that. So there is a lot of benefit to art.
Yes. No, it actually will benefit them a lot because, sometimes when you come in, especially nurses at the bedside, but I guess everybody, you're coming out, you really need to get home and be able to do something that suits you, that has nothing to do with health, and it brings out that person in you that can then be able to say, I'm ready for tomorrow.
Absolutely.
I found myself.
So that's what it is. It's exactly that. What do you like the most about your work? What do you like the most about it?
What I like the most about my work is that I interact with people. I've always been one who loves crowds, I just get excited. I'm carnivals and all that. So like going to New Orleans, you can imagine the Mardi Gras. To me, it was like great. And, there's some people who feel like so, like claustrophobic and all that, but for me it's like, no, I'm fine. So I like human beings, and I'm able to just interact with anybody regardless of what, whether male, female, or whatever race. So that's one thing I like, and I've been able to interact quite a lot with many people, and because of that I find that I also like how people getting to see how people live. I've learned languages sometimes just to say hello and thank you. In Korean, in Chinese, in whatever, I find it warms people to you. To some, for me to land in Korea and go konnichiwa, and it just people just. I mean, in Japan, and go konnichiwa, or Korea, and go annyeonghaseyo shiminika. People just go, oh, and it warms them up
They
to
are
you. And
surprised.
yes,
Yeah, yeah.
yes,
It's
yeah,
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 that's good.
yeah. So
And
I've been able to do that, but also to learn the national anthems of a lot of African countries. It's great when you are a regional director, you are standing next to a president, their anthem goes on, and you are able to sing. I mean, I've seen them turn and look at me like, wow. And when you finish, they shake. It's almost like they're saying, now you're really welcome. So yeah, it's great.
that's good. So, what have you been? What have you found challenging when you were a health minister? What have you found challenging?
I found very few things challenging. I had the support of all my staff, including the medical doctors. I had the support of the president. At that time, African president had said they were going to put 15% of the budget to health. So when the president called me to be minister, I said to him, I'll only come if you give me 15%. And he said, I'm giving you 20. So that with that, I was able to do quite a lot. He said 20, but I want accountability. Every 3 months, I need a report. So I was able to mobilize the very civil society that I have been working with to say, good people, everywhere I go, I want you following me so that, coming before me so that you are able to talk to the grandparents about mother to child transmission. We can bring it down. And we brought it down. Now it's less than 1% in Botswana. In fact, it's the first African country to get the gold award to saying you are eliminating mother to child transmission, syphilis, and hepatitis. So I had, to tell you the truth, I had very few challenges.
So
it was, as far as I'm concerned, it was actually a smooth, sailing in the very sense that I had the support of everybody, my family, my husband. He passed away a few years ago, but he was like really behind me. Yes. Yeah.
Sorry. Yeah. Okay. So in all the different different responsibilities, where do you have found the most challenge?
The most challenge has been with dealing with HIV/AIDS. Actually, even as a minister, it's different. Right now, I'm malaria ambassador. Malaria is pretty straightforward. Your vaccines, you sleep under bed net, you spray, that's it. And you are doing research to improve on things. But HIV has really uncomfortable topics. For example, you are talking about sex itself is a real challenge. So you have to navigate and be able to say, how do we handle this? But on top of that, you have what we call the vulnerable populations, the sex workers, the men who have sex with men, the drug users. Now, talking to presidents later when I was a regional director on these issues was not easy. At least when I was minister, I had a president who understood. He'd be able to say, if you said it's for public health reasons, if you want to have programs for them, go ahead. But later, now dealing with the different presidents, it was not easy. They were arresting sex workers, and I would go to a country to be able to say, look, rather than arrest them, can we have programs for them so that they are not infected and then don't infect them? And it's like, it's illegal. I'm saying, but they are there. So I spend more time doing that kind of advocacy when I was a regional director.
A lot of education.
But I saw also the progress in that. By the time I left, I retired, which was 3 years ago. A lot of countries have programs for sex workers. They have programs for men who have sex with men. They have programs for drug users. Those were challenges, but I was determined that, and we're able to succeed.
Your background in theater give you that the ability to persist, overcome those kind of challenges. Where else do you find strength?
strengths. Well, being a religious person, I mean, I'm also I was born a Catholic, and I've always been a staunch Catholic. I mean, that's how come Pope Francis was able to appoint me to his academy as one of his advisors, because I think he probably figured, look, she is into HIV/AIDS work. She's also a Catholic. How does she juggle, all of these? For example, the Catholic Church would say you should not give condoms, but there I was giving condoms, and I would say, look, I practice evidence-based Catholicism, and right now the evidence is saying without condoms, people will infect and kill each other. And right now, I cannot allow that to happen. So God will forgive me. Yeah. So I mean, my strength is really that, but also my family is also my strength in that I really have. I was able to bring up with my husband, who was very supportive, good citizens who even now they keep saying, "Mom, go for it, go for it." Yeah. So I'm okay.
That's great. So how do you prioritize your activities? How do you decide this activity I can work on, I can take on myself, and the other activities I can delegate? How do you manage that?
Well, I'm simply able to say, how do I? Well, I mean, what kind of time am I able to devote to this? And if it's that, I will then do it. But if it's not, then I won't be able to. It's like right now, as the African Leaders Malaria Alliance, I had to also be at the African Union, as an ambassador. At the same time, I had to go to Rome, to be with the Pope. So I made my trip. Just a question of negotiating to say, look, I'll spend, only 3 days at the African Union because I'm needed on the 5th day at the Vatican. So it's really a question of that. And if anything, and at the same time, the University of Botswana, where I'm chancellor, the Botswana Open University, they wanted me to come and officiate in something. I had to say to them, no, I'm already good. So to me, it's more a question of which is
how much time
and really, yeah.
And then you oversee what the other. How do you make sure that the activities that you are delegating are done correctly?
Well, most of the time it's activities that I'm delegating to somebody who's actually even more capable than me.
Okay.
For example, when the Botswana Open University wanted to do something, I said, no, the vice chancellor, who is a professor, the head of the university. I mean, I'm a chancellor, which is just a titular head. So I knew, let the vice chancellor do that. And I knew that, she'd be more capable than myself in doing that because she knows the university, she knows the students. And of course, I know students because I am popular at home. So students will pressurize to say, we want the chancellor to be here for our graduation so that she's the one who keeps us. And then I do. When it's that graduation, I prioritize that.